There 50, you become a collectible, right? Yeah. Well, it's like, yeah, all the fashion trends are coming back around, right? Like I was back home on the farm where I grew up with my niece and nephew were there on the holiday, and it is hilarious to see the kids rotating back through to the trends of my younger days. Pretty hilarious.
We should have
Whoa.
saved our clothes from back then.
What's that?
We should have saved our clothes from back then.
For sure, right? I know.
My mother-in-law saved my wife's clothes. And can I just say, polyester really doesn't hold up 40 years later.
Ah, it's a little crispy in storage there.
It is absolutely crispy. It's weird. I don't know. It's possible she also starched them before she put them away, but yeah.
Nice.
No, I think that's just like I have like the dress my mom got married in, and it's like this incredibly awesome like brown and orange butterfly print with like 70s giant like yarn made lace, and it is crispy when you touch it because I think it's like 100% polyester. And I sure as heck did not starch it before I put it in the closet. I don't even know how to starch things.
But I mean, it's like that and like cockroaches and Twinkies. Like it'll still exist in 800 years from now.
Indeed.
Oh, Lacey, you're not late.
I'm not late, but I do need to step out briefly at 3:30.
Okay, okay.
Cassette tape. Yeah. I mean, wow. I remember the days when we had the CD players that you had to hold really still because they had like the 5 second skip protection. Y'all remember those? Uh-huh. Yeah.
Walking to class, holding my CD player like perfectly flat so that it wouldn't skip.
We were so cool. Oh my gosh. We were so cool. Um, yeah, that was I have a treadmill in my garage and I was like, man, we've had this thing for a while, and I looked and it has on there iPod compatible on my treadmill, and I'm like, damn, okay. That's been, I've had that for a few years. It's lived its life. Probably time to upgrade and get a new one. So,
Wait, iPod is old now?
when's the last time you saw one, Dan? Do they even sell them anymore?
I don't know.
I had the first one. I remember the first one, the white, kind of chunky, larger one. Yeah. Well, I'm not sure how we got all the way here, but I started with talking about the Festivus pole, if any of y'all get that reference from the Seinfeld days. I've got a lot of problems with you people, and you're going to hear about it. That's been my day a little bit. So I'm going to put that aside for this meeting. It's nice to see all of you and your lovely faces. So, where are we looking as far as quorum? We're got to be
We're
getting pretty
good. We're
close.
at 14.
Hey, let's do it. Annette, take us away.
Right. Welcome, everybody, to the second to the last System Advisory Council meeting of 2025. Welcome, everyone. Annette Machigotami, co-chair, repping those impacted by juvenile legal system and being family voice. Meetings from 3 to 5. This is a virtual meeting. Our regular meeting Zoom link is referenced in what you have. So today's objectives are, we're going to hear from Donnie McAllister, the local system of care coordinator for Central Oregon System of Care. We're going to review our fiscal report for final approval at our December 16th meeting. We're going to have a listening to public comment, review the changes to the strategic plan as a result of public feedback we received, and the plain language edits for final approval at the December 16th meeting. We're going to check in with Adam Peterson about our membership updates. And to close it out, we'll finish up with announcements and housekeeping. turn it over to Adam for roll call.
All right. Yeah, before we jump into the roll call, we have an official announcement to make. Dr. David Ritu, did I put the stress on that in the right spot?
Yeah, perfect. Very
Right
well
on.
done.
Yeah, so yeah, he's the medical director at Lane County Behavioral Health and is our newest council member, so officially appointed by the governor. So, yeah, anything you would like to kind of say to introduce yourself?
No, just that I'm thrilled to be here. I'm a child and adolescent psychiatrist by training, and really looking forward to working with everybody.
Well, we're happy to have you, and yeah, thank you for hanging out the last couple of months and getting kind of adjusted. So it's nice that you've had a couple of meetings to be here before you're officially appointed. He fills the community mental health program director seat, just for folks if you're trying to keep track of what seats are being filled by who. So we'll jump into roll call for the remainder. Allison Stark and Sonia Little Deer Evans.
Here, Allison.
Jackie Serrano and Sandra Santos.
Hola, I'm here.
Hey. Robin Henderson and Anderson Dubois.
This is Robin. I'm here.
Kyle Johnson and Adam Peterson.
Kyle, I'm here.
Adam's here.
Judge Marisa Gates and Jesus Nunez Pineda.
Judge Gates is present.
I'm here. I go by Jacete now. So.
Oh, sorry.
No, you're fine. It's new to me too.
We'll
Okay.
fix it in the slides for next meeting.
Yeah.
Thank you.
Patty Mosley and Emily Cooper.
Patty Mosley's here.
And Emily Cooper's here.
Dan Toma and Cindy Cecil.
Dan Toma here.
Not seeing Cindy. Ebony Clark and Chris Cousins.
Chris is here.
Zafir Michael Berry and Lacey Andreessen.
Present and mostly accounted for.
Same.
Annette Magicotomy and Dana Hiddle.
Here.
Andrew Grover and Dr. David Ritu.
David's here.
Alicia Overstreet.
Alicia's here.
And I am here also. So Adam Rodakowski is present. Okay, Andrew's on vacation. Good deal. Shared agreements. Family and youth, welcome to participate in the meeting at any time. Folks in the public who don't qualify in that category, please save that comment for public comment period and drop items in the chat if you'd like. Private message, Joylene, Carter, Alicia Overstreet, or Annette Magicotomy if you have a comment you want someone to say for you. As always, our group agreements, be present and participate, be respectful, don't interrupt others, and use the name and pronouns folks introduce themselves with. Avoid acronyms, use the chat for definitions or to ask for clarification. Varied and opposing, somebody's on their iPhone making little drawing lines on the slides. That's new. Varied and that threw me off. Varied and opposing ideas are welcome. Challenge ideas, not people. Honor those with quieter voices. Lean in or lean back. We won't do problem solving for individual situations or crises, but we're happy to help offline. Our focus continues to be improving the system of care here in Oregon. Be mindful of the power dynamics you and others hold in the room and be respectful again. And then, as always, let's try and make some solutions happen instead of admiring the problem. So that is our group agreements. The GARE tool, we have been using this now for a couple of years, it feels like. It's the Government Alliance on Race and Equity tool. We use that to address racial disproportionality in our decision making. We've got the following questions to ask when we make a decision on policy, program, and budget. What are the racial equity impacts of this decision? Who will benefit from or be burdened by this decision? Are there strategies to mitigate unintended consequences? And do we need to do a full racial equity worksheet to make sure that we are not moving without examining this appropriately? And that takes a little bit of time and some people hours. So we always want to try and do that as quickly, well, as early in the process as we can. Not quickly, thoughtfully, but as early in the process as we can. Great.
Thank you, Adam. Right now, we're going to have our System of Care Spotlight and welcome Danny McAllister from Central Oregon. She's the SOC coordinator down there. So welcome, Danny, and the mic's all yours.
Thank you very much. And thank you all for having me. Like Annette mentioned, I am the System of Care coordinator for Central Oregon that covers Crook, Jefferson, and Deschutes counties. I am with Pacific Source CCO. And I was asked to just kind of check in and let you guys know what we're focusing on, what we're doing. And we actually have had a pretty upward trajectory this year. I feel like we've made a lot of progress in our system of care, and it's really been thanks to collaboration on a lot of fronts. All of our meetings and committees right now are virtual, with the exception of one in Jefferson County, which is quarterly, and that's in person. But this summer we made a really intentional effort to just get as many people as we could together from as many community partners and family voice members as we could. And we had a great turnout. We had 50 people show up. We ate some pizza and just talked about, what do we want to see happen in the next year in our, in our region? How would that look in an ideal world? And, we're realistic that a lot of the barriers that we're facing they're in need for a higher level of care. So we do what we can on a local level, and that's just kind of where we decided to keep our focus. And so we agreed on 2 prioritized barriers that are universal in all 3 of our regions and across so many different populations within each community. And those barriers were transportation and language access. And basically, we identified those needs and those priorities at that meeting in August. And ever since then, we have just kind of gotten a baseline for each committee, documented that well. And then we're moving forward with, okay, so this is where we know we are with each of these needs in our communities. How would we like that to look? And then later in the year, our goal is to hopefully just move the needle, even if it's a little bit, in a way that will benefit our communities. So that is the work that we're doing. We, at this time, are not actually using any of our grant to pursue that barrier resolution, because we just kind of wanted it to be a grassroots, let's put our brains together and see what we can do with it type of thing. Our grant has been used in a ton of ways to make a local impact, and we're really grateful for the opportunity to do that. This next year, our grant will be focused largely on Agile funds, because we have noticed that makes an impact for kids in ways that none of the other resources in any of our communities are able to do. And so we're kind of just laser focusing on that need and the opportunity to continue to do that. So that is where we are. It's heading in the right direction for sure. And one thing I've noticed that's been really great is that ever since that in-person meeting, there's been a collaboration across the spectrum of services between partners that normally don't interface. And it's been really neat to see that partnership expanding. And actually, our system of care continues to expand too. In the last, let's see, I'm looking at my notes here. Since July, I have been able to do an orientation with 17 new members. So that's really, really exciting. Does anybody have any questions on what we got going on over there? Or over here?
Thank you for that report. That's terrific. Very encouraging.
I'm curious, Danny, who are some of your new, like, what kinds of sectors are you seeing new partnership from? I know we typically see the behavioral health and healthcare space, but wondering if they're in that bucket or from outside. Who is coming to your table?
Yeah, so a lot of nonprofits. We have, and it's also replacements for people who have, transitioned out of their roles. So we have a new interim director with Oregon Family Support Network. The ODHS team for self-sufficiency, I just oriented their whole team. We're always kind of adjacent, but we don't intersect on a regular basis. And so I was just like, hey, I know what you're doing. You kind of sort of know what we're doing. Let's come together. So like we're both fully on the same wavelength. So we're doing a lot of that. But yeah, I would say a lot of nonprofits mostly, which is cool.
And Danny, I did want to mention that 17 new members is very impressive. So congratulations on doing that grassroots outreach.
Thank you. Yeah, it's an exciting time over here. This is the most growth we've seen since I've come on, and I'm excited to see what happens next year. Okay.
Any other questions? All right. Thank you, Danny.
Thanks for having me.
All right. Thank you. Take care. I'll turn it over to Adam.
Yeah, y'all should ask more questions to Danny because that's a lot cooler than what we're about to dive into. Not to like, no, I'm just kidding. Not to shade Anna, or it's the topic, my friend. But all kidding aside, in odd-numbered years, like 2025. We are required to submit a report on how specific services have been funded and how much of those funds have been spent. And so Anna is going to walk us through the draft report of that fiscal today to prepare us to approve and submit the report at our December 16th meeting. So again, this is that kind of shift in our strategy of like, we're going to talk about something, ask questions, have some time to digest, and then in 2 weeks, we'll actually do the vote. So with that, and I apologize for that lead in, Anna.
Yeah, thanks a lot, Adam.
Taking us away with all the exciting discussion of fiscal reporting.
Yeah, and first, I will continue to titillate you with legislative language. So this is the statutory reference, which comes from Senate Bill 4, which was passed in the year 2021. So it says that the council, meaning us, ODHS, or the Oregon Department of Human Services, and the Oregon Health Authority, shall submit a report to the legislature describing monies appropriated or made available to those three entities to provide access to services and supports described in Section 2B of Senate Bill 1, which was passed in 2019. The report must include an accounting of expenditures made by each department and any money remaining unspent at the close of the biennium. So we partner with DHS and OHA to get some accounting information from them. So that Section 2B that I mentioned a second ago lists the following services: in-home intensive behavioral health services, known as IIBHT. Crisis and transition services is named in the statute, but no longer exists. So in the report every year, we get to say, like, we're supposed to report on this thing, but it doesn't exist. The therapeutic foster services, in-home family support services through the Oregon Department of Human Services, either child welfare or IDD services. So those are split out in the report. And their integration with existing residential services for individuals with behavioral health needs and intellectual or developmental disabilities. So I will pull up this very fascinating fiscal report and put it in front of you. You should have gotten a copy of it last week, I think on Tuesday, to review, and then I sent out Christy sent out an updated version of it just yesterday, maybe at the end of the day, because there was one accounting error that was fixed. So highlighted here, December 31st, 2025 is when it is due, but I may submit it earlier. Ideally, I will, because I won't be working that day. So that's just a reminder to make sure we put the correct submission date. And then these are the entities that are required to receive the report. So this is a quick executive summary that explains what I just explained to you. Who is the council? I guess I didn't explain that to you. I hope you know it. And then what is this report and why are we submitting it? You can see it has little anchor links over here on the side. So if people want to skip to a particular issue or topic in the report, they can. This describes the contents of the report in a quick, like if you're a legislator and you just want to know what did we allocate and what was spent, here's your answer, page 2. Feel free to raise your hands or speak up with questions as we go through this. If I don't see you raise your hand, just unmute and say something. So as far as the council is concerned, we have our sort of legislations that have impacted us and named us. And then we talk about the expenditures that we have. So this is for the 23-25 biennium. And we were allocated, we allocated $5,805,591 to the coordinated care organizations, Oregon's 9 federally recognized tribes, and CBOs to accomplish the vision of system of care as outlined in the Senate Bill 1 and then amended by Senate Bill 4. The dashboard is one.
Yeah,
Emily's got a hand up. What's up?
No question.
Oh yeah. So the main question I have is who's the audience? What kind of detail do we need to put in here? And maybe I'm just speaking, this is Emily, as the chair of the grant subcommittee, or was the grant subcommittee chair. But I feel like between with what Danny just said and what the grants, the locals have done, it's just really cool. And so I don't know if it makes sense to add here to some of those like really cool outcomes, and some of the really creative use of Agile funds. But I think we should be really proud of the work that the locals have been doing, Danny included, and, Haley and others. And I don't know if there's a way to like jazz it up a little bit, or like Anna, candidly, if that's not what lawmakers are really looking for. But when I looked over the report, that was the only thing I thought was missing, is just some of those shout outs that, this funding is pretty unusual and the work that has come about is really cool. So that's my only thought.
Got you, Emily. I mean, I hear you, and I think that fits more in the description of the report that we just reviewed and submitted, around sort of like what is the work and what are the remaining barriers and what are the outcomes, right? This one is really just like how much money was allocated and how much money was spent for each of these different services. And so that it feels a little out of scope for this report, but if other folks feel like that's accurate, feel free to have a conversation with Emily in this space. We can make a decision to edit the report, and I can get those edits to you all for review before the 16th. Other folks who are like, yeah, Emily, we want to add some outcome stuff. What do you think? Also nice to have the rest of you here who joined. I saw a couple of folks come in after we did roll call.
I mean, the thing I'll say, I'm just worried about budget cuts, and I'm worried about cuts to us. And so maybe I'm just reading into things too much. Like, we do really cool work. This shouldn't get cut, But Anna, I hear you that this maybe isn't the goal of this report. So thank you for that.
Okay, appreciate you, Emily. And you can follow up with me by email if you have recommended edits that I can just send it directly to me, right? I can make changes and send this out for council review so that we can add it to the final version that we will vote to approve on the 16th. So basically, this is where sort of the rubber hits the road in terms of 27-29 budget. Here's what we got for the 23-25 biennium. Our total legislative funding was $8,399,148, and all of those funds were spent either by us or by the Behavioral Health Division of Oregon Health Authority. So we move into the work that came in from other partners. So here's Mobile Response and Stabilization Services, which has replaced the CATS program in this report. And so they talk a little bit about this covers July 23 through June 25. I apologize. And some of the just really investment work, not outcomes, that have come from that came through the funding that was allocated in the 23-25 budget. So they've improved the community mental health program reporting on mobile response and stabilization services, and that actually is an ongoing process of improvement. I think this is an important component. It's kind of buried in the middle there, but in over the course of that biennium, a total of 614 children were enrolled in stabilization services. So that doesn't include every young person who may have gotten a crisis response experience. They may have gotten it over the phone or in person. But these are the folks who, after that crisis response experience, they were enrolled in some sort of stabilization that was either in home or in community, where services went to that young person and their family and were provided in person in some way. So that is an important increase over the course of the biennium. Dan.
Thanks. I don't know how much we want to get into kind of the sort of policy aspects of this or in this discussion, or if we really want to stay more focused on the fiscal piece of it. But I, note that with MRSS having replaced CATS, those numbers, CATS served a lot more people in its time with probably a lot less funding, I think. And I know MRSS, going back to the early days of this council, was envisioned as a cornerstone, really, of a reformed system of care. And so I'm just, I know that there's been lots of challenges with getting it up and running, and just wondering, as we move forward in the next biennium, do we maybe want to be putting a lot more of our focus on MRSS?
Yeah, I think that's an interesting question, Robin. Is that what you also want to? I know that you were interested in this MRSS information as well.
Yeah, it feels very, it feels very incomplete. And I think that's one of the things that goes throughout this report. When you see these large numbers and then there's other numbers that go in there. And then I see Hillary's comment in the chat saying, this is not everybody who was served. That's really misleading. And it's not helpful. I did the math on the information that I have, and it came out to $28,000 a kid. And I know many of the other issues that are there with MRSS and the locations that they'll respond to, and the issues that we have, especially because this was touted as something that was going to reduce emergency department utilization, and candidly, we're not seeing a drop in that. That's not what's happening for any of us. So I struggle putting our rubber stamp on a report that has significantly incomplete data, because I think it's somewhat misleading.
So would you recommend that we add the number of young folks who get the mobile response, or what makes it less misleading, Robin? I see your hand, Alicia. Do you have a solution to suggest?
Yeah, no, I think the solution is if we're going to present a number and say X number of children were served, then we need to break out and put in here accurately, okay, let's say there were 600 total children who were contacted, 209 of which engaged in services. Whatever those numbers are, that provides a better perspective, because otherwise all you're seeing is this one set of numbers in here that make it look not so great.
Okay, so this is a question to ask OHA. Can they share that mobile response number? And I guess my question is, does this MRSS money fund mobile response as well as stabilization services? You would assume so, since it's called MRSS, but I guess I want to make sure that the dollars we're reporting on are accurate. Julie, I see you shrugging. Do you happen to know? I know OHSU is participating in some information about this program.
Well, having been intimately involved with CATS and then also the transition to MRSS, just to be really super clear, the 988 and mobile response space is not what we're talking about when we refer to MRSS, even though the MR is referring to the mobile response. The stabilization services for this age group that's eligible for this, extended stabilization services beyond that initial mobile crisis response. And Ebony, you probably have more to add here. But that's what we're referring to when we talk about MRSS. And I believe that a lot of money was braided and bundled into the entire crisis system response. But I think it's really worthy of noting, to Dan's point, is that in 11 counties, we served X number of youth in stabilization services through the CATS program over a period of time. MRSS was supposed to expand that model to every county, but we didn't have every county ready to stand up the full program for several years into its inception. So I think that there are some limits to add to your report that are going to give a caveat and contextual understanding of why the numbers are what they are. It's up to other people to interpret that and make judgment around it, but I think it's a much more complex answer than a direct what did we do in CATS and now what are we doing in stabilization services? Even though theoretically stabilization services was supposed to expand CATS throughout, to all youth. I hope that makes sense. Thanks.
Thanks, Ebony. I'm trying to just put questions that folks are naming on this section sort of here. So if what I'm writing down isn't accurate to what you're saying, let me know, because that's what I'll then go do over the course of this next week so I can get the updated draft back to people.
Yeah, no, I mean, it's easy for us to go back and speak to the total funding mix. And when I hear MRSS, I think about the pieces connected with mobile crisis. So I think being able to spell that out does make sense. So, and I will give the team a quick heads up for us to start getting prepped to try to quickly get all of the updated numbers.
Awesome.
And then also, Ebony, you might want to just check in with Beth and Brian regarding like the rules and where this sits in rules, because it is a separate contained space in the rules. And eventually I thought there was a desire to change the rules so that MRSS would take the initial MR and connect it to the SS for the youth that are eligible for, that eligible audience, but I don't think that happened. And so I don't know what ramifications that has in the accounting space.
Thank you.
I don't know if this is really for the report, but I kind of feel like I need to say it. And this kind of goes to Robin, a little bit of what Robin spoke to, is like MRSS was kind of held as a cornerstone to solution, to really reduce the crisis in the kids system, right? Emergency room boarding, hoteling of children, right? And was supposed to kind of alleviate a lot of that. I don't know if I'm impatient or not, but like I certainly don't feel a difference from where I am working every day and supporting young folks with complex behavioral health needs. I can't say that I feel like it's moved the needle at all from my seat. I don't know that that's something we should be putting. I know it's a fiscal report, and but if we're making recommendations, I don't necessarily see where this is moving the needle for me. And I don't know if that's a failure of implementation, or what. But I just want to note that. I don't know that I have. I just feel like I had to say it. I don't know that I have a note for the report itself, unless we want to say that we don't feel like this money has been effective in addressing the needs of the most acute kids in the state.
I hear you. I think, and I'm like, so I see you, Dan, just a second. Emily's point all the way to where we just were, right? I think there's a lot more sort of context and nuance that people are interested in sharing. And so whether that is in this legislative fiscal report or whether that's in another like letter to the legislature that says like, we recently submitted this report and here's some context that we think is really important for understanding what they mean. That might be another strategy to kind of put some words on paper to say, because the fiscal report and the legislative report, I don't think are very connected in anyone's minds, but maybe mine, because I've drafted them both, right? But they are connected in terms of what this means and what that means and what we hope the legislature will do. So I think unless we draw like a thick black line between them and some of these other nuances that folks are naming today, I'm not sure that other people have the expertise that this room has to draw those connections and see how they are meaningful to one another. So that's another suggestion or option that we could consider as like, we can add it as an addendum to this letter, or we can write an additional letter. We're allowed to issue letters to the legislature at any point and just say like, hey, we recently issued this letter and this letter, and we want to add some context here. We hope you'll consider that is these additional items. So that's all up to you, but that's another strategy we could consider. Dan. You're muted.
Thank you. Like Adam, I would say I'm disappointed. I would not recommend reflecting that in this letter. This is a very nuts and bolts, dollars and cents kind of letter. I think in my comments really more geared about how we as a council are looking at this and thinking about this. And I see the 4699 mobile dispatches that, that's a big, that's a very different number from 405 children served in stabilization services. I'm going to editorialize one more little thing here, and then I'll shut up about this. But in the CATS model, the mobile response and the stabilization was connected. They're all done by the same provider group. And as I understand MRSS, it's a referral from one system to another. And my recollection of CATS is you had very good continuity from that outreach to the engagement in stabilization services. And we've got 1 in 10 families going from mobile response to stabilization services. And that feels like it could be a systemic issue. And those might be some of the kinds of things we want to look at in the future.
That is a good point. I don't think I'm smart enough to track all of this right now, to be honest, but we are recording it. And so I can go back and try and pull out this wisdom that is bouncing around and then follow up with people to make sure I'm getting your answers and questions put together correctly. Robin?
Just a quick question, and I put it in the chat and wanted to make sure it got out there. So if this is just a report about MRSS, which is the stabilization services, is this then that 17 million just for the stabilization services portion, or is that for the totality? Because that defines really where the numbers need to line up is in that question. And I can't tell from everything that's in the chat that folks have responded to if this budget is for the totality of MR plus SS or just the stabilization service, which the report is about. So if it is the totality, then it needs to include the totality of what that 17 million is used for.
Sorry, and again, just adding to that is that remember the totality, Hillary, correct if I'm misstating, the totality is all ages. And so then you have to start looking at the, the nesting dolls, right? Because we're really talking about for MRSS, the SS portion is an age specific youth up to age 20. And counting mobile response, every single mobile response, all ages, is one huge number. Then responses to youth under age 20, then of those who got referred into the stabilization services for extended services beyond mobile, which is not available to the adults, different model, and then who was actually enrolled. So you have to really, I think, contextualize the nesting dolls in these numbers and match up the funding however you can, and then frame how many counties actually had it standing up in the 23 year, the 24 year, the 25 year, because that showed a dramatic increase as the program was standing up with all the barriers in place as we were coming out of COVID and redoing the crisis system.
So the one thing I know that we don't have 2025 numbers yet, and they won't be available for this. So just Julie, in terms of like how many counties had it in 23, 24, we may be able to put how many counties have been working on standing it up in 25, but I'll put that. But just want to say that out loud. I know they don't have that full accounting. And then Adam Rodakowski in the chat, I would like to see if it had any actual impact on the higher end of the system, which is what was sold to us prior to implementation. Anecdotally, it certainly hasn't been impactful from my viewpoint in the system. I think that echoes kind of what Robin was saying as well, that in terms of this is supposed to decrease emergency room utilization for youth behavioral health crises, and we are not seeing, as of right now, that number go down. Is that accurate, Robin? That rate of use for
Yeah, that's accurate.
And
there's differing interpretations of whether or not MRSS needs to respond to a hospital emergency department upon request when that department does not have the ability to support a youth in the way they need to be supported, especially in rural areas. And that lack of clarity is, it varies by county. And it is really difficult for hospitals in Oregon to track 36 different points of light.
I think we can go on to the next, Anna, when you're ready.
Okay. So I will do some following up. I know Ebony is listening to this conversation and Hillary is listening to this conversation. I also know OHSU is part of this work and Julie's here, right? So we've got at least some good folks listening to these questions to try to get answers back. I will chase down answers and get you out some updated draft on this soon. As we mentioned earlier, crisis and transition services no longer exist, but because it's statutorily required to be in the report, we just continue to sort of say the same thing, that it doesn't exist anymore. Very technical, boring language. And then we move to the interdisciplinary assessment teams, and we have a little bit of background here because the IATs are described in the Senate Bill 1 about sort of what is the point. They're intended to provide rapid access to evaluation, assessments, and stabilization services for youth who are, particularly those who are in child welfare custody, at risk of or placed in temp lodging, in emergency room boarding, shelter care, county juvenile, because of lack of an assessment, right? That is actually in statute about why IAT was being created in Senate Bill 1. So the IAT services that have been created are called the EASY program, Expedited Assessment Services for Youth. And this is just information that was provided by OHA, the Oregon Health Authority. EASY is not intended to serve all youth in need of assessments, but prioritizes quick assessments for youth with complex presentations in need of care or services due to a crisis. Criteria for referral are youth at risk for disruption from their home or school, experiencing or at risk for temporary lodging, multiple visits to an emergency department for mental health, or those at risk for involvement of juvenile justice, child welfare, or the Oregon Youth Authority. We included testing is provided within 7-10 days of referral, is mobile within an hour's distance of the provider. There are some providers spread across sort of the western side of the state, and is insurance neutral, which is, I think, something that has been continuously important to this council. 40% of referrals are coming directly from family members, and you can follow this link to find the referral form that exists on the Oregon Health Authority's webpage. As of the writing of this report, so the sort of the one pager says that over 500 referrals have been made to the EASY program. It doesn't say how many actual assessments have taken place. But it also says that there are 3 hubs, one in Multnomah County, one in Deschutes County, and one in Lane County. But as of the writing of this report, referrals in Deschutes County were not being accepted. So access, just again, maybe worth saying out loud, you can get access to this EASY program if you live within an hour's driving time of Multnomah or Deschutes, where those providers are. If you live elsewhere in the state, you may not have access to these assessment services. Robin.
This kind of follows along in my earlier commentary that having a funding number in this without having a number of youth served, I don't think serves us well. And having 500 referrals, over 500 referrals, doesn't tell me how many kids actually got an assessment. You could have like 500 referrals and only seen 2 children. And the other question that comes in, much psychological testing and other types of testing is covered by Medicaid. So if some of these services are covered by Medicaid, is there, is this subsidizing funding? Is this instead of those other types of things in there? And maybe that's not so important for this report to talk about what are the additional funds that are utilized to support this program. But without any idea of the number of referrals that the program has seen, it's really difficult to go, yeah, I don't know what I feel about this. I think also coming from somebody who actually designed the initial Senate Bill 1 and knew what this was supposed to be doing, this isn't what was originally designed. And I don't know at what point there's an assessment of how do we reconcile what the original bill called for and do we still have a need for what was initially designed. I imagine that the child and adolescent provider community would say that is still a wildly unmet need.
How many assessments were provided to youth on OHP? Does this $2 million pay for costs outside of those OHP covered expenses, Robin? Is that an accurate representation of your fiscal questions?
Yep.
Okay. And then I see Christy put in the chat, here's data Jesse, I'm assuming Jesse Egan provided last month. I don't know, Christy, I don't know where that data was provided. Feel free to speak up if you have it, but let me finish reading the comment first. 387 youth have been referred to EASY and pre-screened for the program. Of these youth, 242 were suspected of having a developmental disability, 26 were already eligible for DD services, and 184 have been evaluated through the EASY program.
Yeah, that came to us in after a request I made to finalize a barrier resolution letter for Lane County.
So I'm gonna copy and paste that because that's 387 and this says 500.
Mm-hmm.
Oh, I didn't mean to only copy that one section. All right. You guys are giving me lots of work to do. IIBHT. Any further questions or discussion about EASY? Yeah, Selby's same. We'll find out. Selby's wondering about the 387 versus the 500 in the chat. And then Adam Peterson in the chat noting if 184 youth have received the assessment, that's a total of $10,891 per EASY assessment. Y'all are quick on your math. IIBHT is an intensive community-based alternative to residential treatment and inpatient hospitalization. They do not follow a biennial budget cycle with the funding for this program. So we only have 2023 and 2024 like actual calendar year information, not fiscal year information, which is like July 1st through June 31st. So for 23-24, in 23, there were 232 youth enrolled in the in-home intensive behavioral health treatment program with certified providers through counties. And the number of enrollments increased to 275 youth in 2024. We are seeing very low enrollment for young adults ages 18 through 20, but the youngest person enrolled in services was just 2 years of age. All 16 CCOs report having provided IBHT services to youth in 2024. However, 9 of the 23 certified in-home intensive behavioral health treatment providers reported that they served 10 or fewer youth. So that is less than 90 total youth, right? If you're doing that math within the calendar year. There was a partially pushed by the System of Care Advisory Council, the Health Authority completed extensive community engagement and did some rule changes or OAR changes for the IBHT program. Those rule changes went into effect in March of this year, and community continues to report wait lists and difficulty accessing these services across the states. The coordinated care organizations are required to notify the Oregon Health Authority when their members are unable to access those services promptly through the counties, and providers continue to report difficulty in recruiting and maintaining the workforce to provide these in-home services. So here's the link to the annual reports, and the 2023 6-month Ombuds report included specific recommendations around resolving barriers to increase accessibility and capacity within the IBHT program that are still needing to be implemented. In terms of the funding, it's impossible really to report on how much money is going to the IIBHT services because CCOs are just funded for a global budget for this section of work, and then they just have to make IIBHT happen from within that money, but they're not counting how much of that money is going to IIBHT or other things that live under that global budget, so it's not something we can track back to a dollars and cents kind of answer. Questions or comments on that? Robin.
You know, you're going to miss me when you don't have me to ask these questions. So I'm going to get them all in right now. You know, I think the hardest part about this is when you see in the commentary, and I don't know that there's anything we can do about this, but when you see in the commentary that, you know, however many of these counties saw 10 or less people, proportionally, does that mean their funding's adjusted to reflect that? Or does that money just get swept into the big bucket of everything else we do? And I know the answer is the money just gets swept up into the bucket of everything else we do. So where is the incentive for CCOs to assist in the development of IABHT in their communities if they get the money, whether they use it or not?
Does anybody in like OHA or CCO land know if there's an incentive for or county behavioral health, Dr. Ratu? Do you ever see incentives, right, to ensure that youth are getting access to in-home behavioral health treatment where appropriate?
We're one of those places that really struggles getting kids who need the service, that service.
So you're seeing it on the deficit side.
Yep. We don't even ask sometimes anymore.
Just because you're so used to hearing no.
Yeah.
So I don't know, maybe that's a question I can ask. I don't even know who that would go to. It's definitely an OHA question, but if it's a procurement
Yeah. No, I mean, I think that's a good question, but that can be shepherded. You know, I mean, obviously we got to connect with our Medicaid colleagues, but you know, you route that to behavioral health, and we can help work on getting a response and all that.
I'm also curious, the changes to the OARs was intended to help with all of these problems, and I'm curious about the observations of people who are close to the service, the extent to which that is making a difference.
I feel like the off the top of my head response or answer to that is that, obviously the pandemic blew all of that up, and then trying to rebuild or restabilize the services, has been a process that's been fraught with challenges and barriers. Just as an example, the workforce issue. But that's kind of my anecdotal answer.
Thanks, Ebony.
Allison.
Yeah, I as an organization that used to provide, a different version of IIBHT and is now looking to potentially get into IIBHT again, it's not easy, right? There's a lot of barriers to entry, I think, generally speaking, that I don't know how you plan for, though, I guess is what I would say. For example, I think anytime you have a new service that you're trying to get people to engage with, there's a lot of support that's needed for that organization to feel comfortable that they understand what the guardrails are, those kinds of things. And so I do think, I don't know that this is the conversation for today right now for this report, but I do think it is a general conversation that might be useful to have, because one of my concerns would be that this program is on the chopping block when you're looking at ways. I mean, there's a lot of rule written around it. There's a lot of infrastructure around it. So I think the reality is it's probably going to be a hard program to let go of, but there isn't the utilization that we know we need of it. And we need to reduce barriers for providers to get into doing this. So.
Thanks, Allison. That's helpful. And like I said, I'll go back to this video and try to pull out nuggets of wisdom that folks have shared. So I don't know, Allison, if there's a note you want me to make on this report to sort of address that comment, I'm happy to do so. And you're welcome to follow up with me via email, but also I'll try to pull anything out that you just said that might help inform this report or make it better. Okay, I'm recognizing that we're over time. Our facilitators are being gracious with me. I know Christy and I think Alicia both mentioning that Yamhill County has reached out to OHA about some IIBHT barriers as well. So we're continuing to kind of dig in to that specific topic as well. So more on that to come before, by December 9th, so that you have a week at least to look at the report before we have to vote to approve it. Moving to child welfare, this is looking at in-home child welfare services, so housing support, navigation and engagement supports, home visiting and relief nursery, agile and flex funds, and support for community-based, should say, substance use providers, treatment providers that serve parents with children currently in the home. And that is a strong priority of our Youth Addiction Alliance young folks. Child Welfare invested $2 million in tribal partnerships on specific things like housing support, parenting and education services, home visiting, transportation, workshops to address family violence, support for tribal best practices. And then in 23 and 24, Child Welfare staff worked with SOCAC staff to try to align and enhance their $2 million of investments around system of care work with our $5 million worth of investments around system of care work, so that at least where we're making investments in the tribal spaces, they're aligning and enhancing rather than overlapping. And that felt like really productive work that we did in partnership with DHS Child Welfare. They have a parent mentor program that supports parents through mentors who've also experienced the child welfare system. I know that Morrison is part of that project. Not sure if there's more people would want to say about that. And then community prevention funds for 24-25 have already been allocated out. And child welfare is looking at a new quality improvement framework to really try to track outcomes rather than just services delivered. I don't know, Lacey, if there's more you'd want to say about that section.
No, I think you covered it nicely. I think I'll speak specifically on behalf of the tribes. They have, we meet with them quarterly at an advisory, or representatives from the tribes at an advisory, and they have expressed a lot of gratitude for this money and felt like they've been able to use it in really great and unique ways. So I think it's been really helpful.
Yeah, very cool stuff happening. So that specific investment, sort of the system of care investments that DHS is doing separately from the SOCAC is $14.8 million from the 23-25 biennium. And then we get into the specific named service. So behavioral health treatment foster care. There's some information here about how BHTFC was sort of overlaid on top of the Proctor Care program and why that was done. And then some spring and fall updates that there's been a steering committee to try to build behavioral health treatment foster care into a bit more robust program. Then here's some sort of dot points around the 5-year pilot and sort of the timelines that things took place. And these funds, $10,145,446 was spent in the biennium on building the behavioral health treatment foster care service. And that is braided general funds, Medicaid funds, and Title IV-E funds. I don't know, again, if there are questions, comments, or additional context people are looking for here. Adam.
Just my question is more total context about this report. We're not saying we as the System of Care Advisory Council agree that this is the best spending of this money. We're just saying this thing was spent and these are the things that was spent on, but without any like recommendation, judgment, or anything. It's just statements, right?
Yeah.
Okay, thank you. Helpful.
And then moving into the IDD investments that DHS is making, really prioritizing, again, host homes as the named service. Why these are the only things we report on, again, I don't know. This is what the law was structured to do, and so this is what we're doing. In Q3 of 2023, there were 8 host homes. I know they were expanding at some point on those. And again, that's sort of the end of the like, here's the dollar amounts that we can count, because after that point, the host homes were made part of the general ODDS budget. And so they're just funded as they expand without really looking at what was allocated and expended. It's just sort of part of how DD Services does their work now. And Lacey, I don't know if there's more you want to say about that. You probably could report to us what you've spent, but we don't have a specific legislative allocation. It's not in legislatively approved budget like that anymore.
That's correct.
So that's what it is. RE Child Welfare section from Selby, Agile and Flex funds for concrete supports. I'm so proud of the System of Care Agile funding initiatives, which are county-based, and feel like they really need to be identified as a signature System of Care initiative. Could this line be made more specific? Like, for example, System of Care Agile funding, Medicaid Flex funding benefit, or something like that. Surely it can be. Let me go up and try to find, and then I will stop on this. Just do Flex. Probably. Agile Flex funds. So I'm just going to copy this comment and put it here and edit it and send this out to folks with those, whatever changes I come up with, they'll be highlighted in track changes, so you'll be able to see them. All right, so I have a lot of work. I have a lot of work to do, and I will work on it and get this out to you next week.
Thanks, Anna.
You're welcome.
It is now time for public comment. So the floor is open. Either raise your hand or just unmute yourself. It's time for public comment. Don't see any hands for public comment. Leave it open for about another 45 seconds or so. Alicia's not getting any questions on her end. And Joylene, if you have any, if someone's reached out to you, do you have any? Joylene and Alicia are available if you want to ask a question, but you want someone else to do that for you. Joylene and Alicia are available to do that. Okay, seeing no hands.
All right. No
Go for it, Adam.
Festivus. Yeah, no Festivus airing of grievances from the public today, it looks like.
Sorry, I don't mean to interrupt. I did get a note saying that there is a public comment from a family, but they're still writing it.
Okay. Well, we will hold on for a moment then.
Thanks. Okay, so the question that I got was, how are the organizations that get money to do a service like IABHT and MRSS or EASY accountable to the spending on that?
I mean, so there's a different answer, I think, to each of those services on how they're accountable to the spending of that. I certainly am not an expert. I think most of those funds come, MRSS, IBHT, and EZ come through OHA. So Ebony would probably be the best person to take that, I think, on the call. I don't know if Ebony, you can speak to that.
Can you repeat the question? I'm sorry.
Yeah, the question is, how are the organizations that get money to do a service like IABHT and MRSS or EASY accountable to the spending on that?
Good question. So basically, there are various reporting terms in the various contracts. And so, and some of those reporting requirements also include financial reporting, backing up from that. Generally, when an organization and or let's say an entity is identified and steps into a contract, part of the process is also budget negotiations where they will submit a preliminary budget that then is reviewed and approved, and budgets ideally include kind of staffing costs, indirect costs. Sometimes, depending on the service, it might include a small amount of flex funds, things like that. And so a contract is also approved based on the approved budget, in addition to any associated financial reporting requirements.
Okay. Thanks, Ebony. So I have a follow-up, I guess, question or statement. And it says that, from this family member, it says that specific to the numbers served and whether the money meant for youth and families are spent on youth and families and not the overall crisis system. So I guess
yeah, well, I can say that. So for, let's say, talking about IIBHT, part of or let's say MRSS. Part of MRSS is one strategy that's used to provide crisis supports to youth and families. And so the dollars can only be spent on providing those services to an individual, or an identified youth and family, those dollars can only be spent on that specific scope. So if an organization or entity were using those dollars for something that was not approved in the budget, then that's a compliance issue. And also what I will say is that a lot of times budgets will speak to a certain number of individuals or that will be served. That also backs into kind of the estimate in terms of staffing. So let's say that one individual was served, but let's say they got $1 million for the program, then obviously that's an issue. And that's not a good or an effective use of dollars. And so then that's a separate conversation. So this is a very complex question, a good question. I don't want to take too much time, but that's, kind of just one example to a complex question.
Thank you. I didn't get any other follow-ups on that, but I can reach out to the family member and see if they want to dig in some more later on.
And Alicia, you can pass additional questions from this conversation to me to get more detailed answers in response.
All right, sounds good.
Thanks.
Thank you. Thank you. I'll go ahead and turn it over to Adam.
Okay. So the public comment period for our strategic plan has ended. That ended on November 14th. Staff and our consultants have been working to understand and incorporate that feedback. So Christy and the team are going to walk us through what we heard from the public, our partners, and community-based organizations that contributed in the planning process. We also had the plan edited for plain language and readability. So the version you got this morning is as close to final as we have. We're going to review today, and again, approval vote December 16th. Christy Hudson, over to you, friend.
Yeah, we're getting close, folks. Just a couple more weeks to go, and I think we are in really good shape. So we're going to talk a little bit about the feedback process, a little review of what we did, how we gathered feedback, and then we have approximately, I think, 7 kind of primary findings, and 2 recommended changes to the plan that I think we're going to take a formal vote on. But they're pretty small. I don't think there'll be too much concern about it.
Oh, don't ever say that. You're just going to set yourself
I'm
up.
jinxing it.
They're going to be huge, massive. I'm just teasing.
Addie, do you want me to kind of set the stage and then you can get into the findings, or
whichever works best for you? I'm happy to be helpful. So you make your choice.
Okay. Well, how about I'll talk a little bit about the method and then
Great.
you can go over the findings and what the recommendation is. Okay. So we started a formal public feedback process early November. The primary purpose of these few weeks was to gauge overall approval for direction of the plan. Are we generally getting things right in this plan? We also really wanted to make sure that youth and family suggestions have been accurately captured in the plan. We engaged a lot of people earlier this year in the spring via the retreat, via grants to community-based organizations. We had some data parties and action parties. We went back to all of those people to say, hey, did we get you right? You had a lot of good ideas. Do you see them in this plan? We also asked people to give us a sense for what goals, strategies, or actions they felt were most important, and to kind of give us a sense of what things we should get started with in 2026. And then there was kind of a general question about, like, did we miss anything major here? In total, we had 200 people kind of tell us what they thought. We had a survey that SOCAC put out via emails to a lot of different people. I think we got 28 responses to that survey. We also provided an additional $10,000 to each of the 5 community-based organizations that we engaged earlier this year. So just to refresh your memory, we reached out to Eastern Oregon, CCO or GOBI to reach rural families. We reached a funded Home Plate Youth to reach youth experiencing homelessness. We worked with Fact Oregon to reach parents and caregivers of youth with IDD. We worked with the Pathfinder Network to hear from youth who had been involved in the juvenile legal system. And then we funded Morrison Child and Family Services to hear from family members who have been involved in the child welfare system. So they did lots of great work. All of their reports, if you are curious, what they had to say are all posted online on our strategic planning website now. And then we had a few emails. Some of our regional system of care partners invited us to present and hear directly from the partners that they're convening regionally. We had a few folks provide public comment in November. And in total, we had about 200 people. Oh, we also had a feedback party. That was great. Really well attended, and directed those people to really tell us what they thought in the survey. But there was a lot of great discussion there as well. Okay, next slide, please. Okay, here's what we heard. Addie?
Yeah. First, I just want to congratulate this group on being very brave, getting feedback at this point in the planning process and asking folks specifically, did you feel heard and did we get it right? I think takes a lot of courage. I was certainly nervous and knew my palms were sweating. It can be really hard to hear that that isn't the case, especially when you feel like you're almost done and you maybe have a little bit of planning fatigue, which some of us might have. So just really nicely done on executing this really thorough plan to get feedback at this point instead of just sort of sending it out there and seeing if anyone responds. So I just want to kick off with that. And then I want to say that kind of overall the feedback was resoundingly positive, especially when it comes to people feeling heard, which everyone, I want to do that sort of like preschool teacher thing where we all like raise our hand and then pat ourselves on the back for that. That's a really great piece of feedback for us to all sit with. It wasn't perfect across the board. Of course it wasn't. There were folks who had differing opinions on that, but it was vast majority of folks felt both like we were headed in the right direction and like we were heard. So you'll see that in the first bullet point. You'll also see youth and family members validated that their ideas and suggestions had been incorporated into the plan. So a lot of folks who felt like things had been taken seriously, not just heard, but put into the plan. There was, of course, some healthy skepticism about the feasibility of implementing the plan. That's what we would hope to see and hope to know, right? It's a heavy lift. We all know that. And that's why we created not just the strategic plan, but of course also the implementation plan. So we want to go from words to action, and we have all of those very clear action steps, which at our last meeting, all of you helped us also identify who was going to be the sponsor from SOCAC, what the deadlines should be, and the notes we needed to get those done. There was conversation about the need to modify language to be more accessible and easily understood. Unfortunately, on the timeline we were working on, this was out for a plain language sort of review or translation while it was also out for public comment. Certainly something that I know SOCAC staff and I have taken note of. So next time the version that we send out for comment, we will be sure to have already brought into plain language. But you'll know that we've addressed that. The version you received this morning is that plain language sort of review translation, so that it is more generally accessible to individuals. So we both took that feedback, but we're also in the process of already sort of putting that feedback into action. Then I'm talking about prioritizing strategies and actions and specific strategies and actions that folks really wanted us to prioritize. Good news, our work specifically with our youth and families, putting together the sort of key action steps, key strategies that we wanted to see happen, really aligned with the feedback we got. So it was a really nice dovetail and just a good way to validate when people said that they felt like they were heard, that in fact they were doubly heard, because it's not just that their information made it into the document, but that in fact our priorities aligned with their priorities as well. And then we had some conversation about suggestions to add indicators related to out-of-home placements and the experience of youth and family engagement. So on this one, as you all remember, we had a robust conversation at our in-person meeting about increasing the key indicator or adding the key indicator about family engagement. So that was something that, based on this feedback and our conversation at the last meeting, has been included. You will see in the version that you received already, because it had come up as something worth doing. And then as it relates to out-of-home placements, that was something both at the data committee considered, but because of the varying definitions of out-of-home placements, we actually have the opposite indicator, or in fact, the positive of that, which is how often are youth receiving services in their homes, communities, and with their families. So although we are not measuring the out-of-home placements, we are measuring the positive, what we want to see increase and grow, which is those in-home placements. And then, of course, there was quite a bit of feedback about the plan lacking strategies relating to meeting basic needs, housing, food, income, transportation. And of course, one of the things that the plan really sets out in the opening paragraphs or the beginning is what is the role of SOCAC, and where do we target our energy and our efforts statutorily. And although everyone would agree in the virtual room we're talking in that these are really important, and when these dovetail with the larger mission of SOCAC, they are a priority. We talk quite a bit in the introductory paragraphs of the plan about how these aren't our specific mission, but we support them and we support the entities whose mission is both primary, secondary, and tertiary prevention. So we have some of those pieces in the plan in a different way. So a lot of this feedback, as I'm kind of describing, is really already in the plan in a different format, but really validating what we heard. So I think next slide. All right. So the two recommendations that we want to bring to you, and I know you all received a larger document, so I'm giving the overview with the assumption that you read the document. You'll see each of these pieces of feedback that were trendy, trend-ish, came up frequently, lined out, and then the response that we as the strategic planning core group came up with to them. The responses reflect what I just discussed. Oh, that's already in there. Oh, that's great news. Oh, we didn't measure that because we measured the converse or the opposite of that, et cetera. There were two comments that we as the strategic planning core group, and I shouldn't say we, but the strategic planning core group with guidance from staff and consultants thought, hey, that's a really good idea that we probably need to bake into the plan. That's a miss on our part, and this is why we get feedback so that we can make changes. These are the things that Christy was indicating we'll need to vote on today. As you all have probably noticed, I've been pretty vehement that we aren't making any substantive changes to the strategic plan without the agreement of the entire council, because we crafted so many of those goals, strategies, indicators, progress measures in very specific detail with the right team of SOCAC experts to get the right words and language. So we've really avoided changing language. And even when we sent it off for plain language review, there were large swaths of the document that were highlighted where we said, you can't touch this. This is what we've negotiated as a group. But we did have two that we really want to talk about adding so that we can better meet the feedback that we received. So that's what's on this slide. And the first one was the plan lacks strategies specific to rural areas. And although we found that we have action steps in the implementation plan that are about things necessary to rural areas, one of the things we noticed was that we don't call it out specifically in our goals and strategies. And so we would propose that we actually add the language to goal 1, strategy 2, so that it says decreasing barriers to access care in rural areas, especially transportation, which came up over and over and over again in the feedback we received. And what that would do is highlight that it was something we talked a lot about. It was something we took into consideration. It is something that shows up in the action steps. And it's something that here in Oregon and for SOCAC, it's important enough that it rises to the level of being put sort of in black and white on the page. The other piece was, in addition to the concern about not discussing basic needs enough, there was a great deal of feedback that the plan wasn't prevention oriented enough. And one of the things that the core, and of course, core team members, if you want to correct me, jump in at any time. And Anna, I see your hand is up, so I will wrap up and then let you jump in. One of the things that the core team, the strategy team really talked about was that we do prevention at SOCAC, but it's sort of upstream prevention, not the downstream prevention. And so one way that we can really clarify that, in fact, this plan does have some prevention, but it's we're on the brink of a crisis. How do we interject and avoid the crisis? That's well within the bandwidth or the mission of SOCAC. It's not we have a young person who's nowhere near crisis, but in 3 years could be in crisis if we don't get the right interventions in place, right? So that primary universal type prevention versus the tertiary, we're teetering on the edge of a crisis prevention, which is in SOCAC's wheelhouse. And we thought one way to best clarify that was in the sections where we talk about the fact that this plan doesn't cover prevention, we be crystal clear about which prevention it doesn't cover, that being universal and primary, by adding very clear definitions. And the idea is to add those definitions sort of in an appendix where we have a series of definitions. So when you see it in the document, you can turn to that. And Christy is, I think, putting it in the chat right now so folks can really wrap their heads around what we are suggesting. All right, Anna, jump in. I'm sorry, I just talked a lot.
No, that was great. I think just to add a little bit of context, we've talked a lot about how like transportation isn't our thing, right? And so we added a little bit of language to say like we are not talking about access to public transportation, very similar to what Addie just said around the prevention definition, right? We're not talking about folks who lack access to a vehicle and that is a barrier to like all of their life, right? But what we are talking about is transportation as a barrier to access to care and services. So non-emergency medical transport for youth and young adults. That's sort of in our bandwidth of things that are our problem to work on solving, right? We heard from a family in rural Eastern Oregon. I guess that's kind of duplicative, like in Eastern Oregon, who has a young person with severe disabilities who needs support from Western Oregon in order to get into a vehicle, but they can't get that support without getting to Western Oregon. Like that's nonsensical, right? Like how are they supposed to get their kid across the state if they can't get their kid into a car, right? So that is a barrier for access to care. That is sort of their level, that young person's level of complexity and rurality. The fact that it is a barrier to access to all of the care and services that they need, that is our scope, right? And so I just wanted to clarify when we're talking about adding transportation, we are not opening this door wide up to say now we're going to put ODOT on the SOCAC. We're talking about really where transportation is a barrier to access to the services that Addie was describing. Sorry.
So that's great. I'm of course open to any thoughts or comments, especially from the core team members where we walked through each of these in great detail to make sure that we felt it was either adequately included in the plan already or it needed to be an addition. Just so folks know the plan today is just to approve these two additions which come to you from the recommendations of the core team. That's it today. I know we just got you the plain language this morning. It would be on the 16th then that we're finalizing and approving the plan as a whole. So just so we know what we're voting on today, to repeat, it's just, does everyone agree that based on the feedback we received from those 200 folks who provided us feedback, we do think these two misses or these two opportunities, I should use that strength-based language, should be included in the plan to make our great plan even better. So I think this is where we say, is there anyone who, Emily, thoughts on that?
I move to approve these two changes. I will say this as a commentary as part of the core team. I think to Anna's point, this was nothing new. Like we thought about this, but what's important about adding these is that, so much of us are on the I-5 corridor, and the thoughtful process that Christy and other, Christy led, but we all supported Anna primarily, is making sure we're not leaving any of these communities out. And so I really think it's important that we do include it. And so, oh shoot, I forgot we have a consensus model. Blurg. Anyway, I think I think it's a great thing. I'm glad we did it. I am really proud of this. I think we did a very thoughtful, deliberate job. And Addie, thank you so much for seeing us through it.
Adam, thoughts?
I was going to second the motion that we vote.
Awesome. I love that. So I think since it's a consensus model, if people are comfortable, what I might say is if there's anyone who disagrees, now would be the time to let us know, because then we would know we don't have consensus. And I'm just going to scroll through to make sure. I know we have lots of people looking, but I don't want anyone to feel.
Emily, I presume your hand is still at carryover, but maybe you want to take
I'll take it down now.
I'm assuming from what she just said, she's
I
not
know,
blocking
she
her
made
own
the
motion,
motion.
but maybe she is.
Okay, so we will work on getting these additions made and then promptly resending the draft with these included.
So the drafts people received this morning actually included these changes already.
Ooh, optimistic, Christy.
Forgive me
You're
for
braver
that.
than me.
I did that because we are on a tight timeline, y'all. So we are really trying to get this back to our plain language editor by Friday. So that means you have tomorrow and Thursday to give it a final read through. And if there is anything, any language specifically that you can't live with or you have concern about, now is your last chance to let me know, as we are going to be moving that document to final in preparation for the vote on the 16th.
Couple of quick things on that. Send your suggested edits, questions, concerns directly to Christy. Do not send them to everyone on the council to avoid serial communications that do not conform to public meeting law. And Christy will put together a you said I did kind of document for any of that feedback that came in via email. And Christy, the draft you sent out, does it include the blue and yellow highlights of the don't touch this stuff? Okay.
No, it was pretty messy, as you can imagine. So I sent you the cleanest version that I could get to. If you have questions or you want to go back to the original language, if you want to see the track changes version of it, I am happy to send that to you. I think the other thing you might be wondering in terms of plain language and where the reading level is today, according to our contractor, the executive summary is at a ninth grade reading level. And the body of the plan is at an 11th grade reading level. That doesn't include the language that we told them not to touch. That's just the changes. That's just the parts of the plan that we said you can go ahead and mess with this language to make it a little bit easier. So grade 9, grade 11, if you have concerns about that, happy to talk with you more about it.
So any small changes or corrections, please let Christy know. I think you all know me well enough to know by now I don't love surprises. So if for some reason come the 16th, you believe you will be voting no, that we are not ready to finalize this for any reason, I would greatly appreciate an email, not at 10:35 on the 15th, but perhaps slightly before that, so that if something does need to be considered, discussed, or addressed, there is an opportunity to come with a solution on the 16th that gets us to a place where people are comfortable. So I would just ask, if you're feeling that way, that you just give me a heads up about it, as opposed to sort of coming into the meeting ready to vote no or ready to suggest a whole series of substantive changes, so that if need be, the SOCAC staff and I, or if really need be, the SOCAC staff, the core team and I can get together to bring something solution focused on the 16th, because as you all know, sort of our deadline here on this is the 1st. And although we are well set up to beat the deadline, we are closer to it than I would like to be. So just a gentle request for my own well-being and heart health. Sorry, Adam, I think I stepped on your toes because you had raised your hand.
No, you're fine. I think, I was going to do something like that just to keep you on your toes, Eddie. No, I would never. No, I just wanted to say, thank you and appreciation to you, Addie, to Christy, to the whole team, right? Joylene, like everybody, Anna, all the whole Cody, the whole team, Corinna, like y'all did a fantastic job, a ton of work. Like I'm very appreciative, and I just want to say that out loud as one of the chairs of the council. Like I think I'll speak for Annette too, that we really do appreciate everything that y'all did to get this plan together. Much better than the first go around the process. I'll take that as a win. And then I just wanted to say, like, this is all really great, and now is the time for the doing, right? And so to our state partners, to our friends that are state employees on this council and their peers and other leaders of the state, like, we need you all to be on board with this and on board with each other. We do not have time for infighting internal to agencies or across agencies or gatekeeping. Like the time, we don't have any more time, folks. Like this has gone on far too long. And so I'm begging y'all to do whatever you need to do to move this thing forward, because I think the community is here with you. We are all on the same page, and we need to actually like start the advancing of the work. So grateful to the planning and the drafting, and let's get ready for 2026.
Well said, sir. I don't know who's on the presenter's agenda. Is that you?
Me.
Got you. I'll
We're
stop.
going to have a membership update from Adam Peterson. Go ahead, Adam.
Hey, folks. First of all, huge shout out to our interview panel, which includes Annette, Alicia, Gisette, and Anna. We are having a blast meeting a lot of really great people and having really good conversations with a lot of just, great folks who would add a lot to this, to our council. So we're going to finish up our interviews for our CCO and child psychologist spots this week. And then next week, we have family voice interviews. It says 2 seats, but we're really only doing 1. So I'm not really sure where that is. So we only have 1 open family voice seat. And we are, or Anna, go ahead. Did I mess up in this?
We're doing interviews. We had another applicant for the seat that Alicia currently occupies as well.
Okay.
So we both Alicia's and Annette's seats are technically open.
Got it. Okay. Sounds good. So yeah, we have multiple family seats that we're going to be interviewing for next week. The folks who are, we didn't receive a huge response for our pediatrician and tribal member openings. So we are really gonna try to do some focused recruitment for those positions and like begin our year with that, as well as then our new seats that are going to be opening up through our recent Senate bill. So that is what we've got going on currently. Also, a thank you to for members who are exiting from SOCAC. Anna and I have been engaging in exit interviews with folks just to have a better understanding about people's experience on our council, and where there's some areas that could be improved, things that people liked. And I think it's going to really add a lot to our onboarding process for new members. And it's so a thank you for those who have opened up their time to have those conversations as well.
Thank you, Adam. Now we're going to move to our announcements. Council member annual training required by 12/31. I'm sure most of you have gotten those emails. They need to be completed by December 31st. And you're on prevention of discrimination and harassment and information security. So be sure to get those trainings done by December 31st. And does staff have any other announcements you'd like to mention?
You know we do, Miss Annette. If your name is on this list, you get a gold star. If your name is not on this list, please complete your training if you don't know how to get into Workday. And I apologize, almost all the people on this list had a hellish time getting into Workday. So you can provide some peer support for those folks who have to get back into their stupid Workday account to get those trainings done. Corinna and I can support you in getting that process completed. So reach out to us. Next set of announcements. We would like your feedback on the plain language edits and stuff by the end of this week. We have to finalize with that vendor, the plain language vendor, by Friday, I think. So if there's any changes there, we need them ASAP, and those go to Christy. The implementation plan, Christy, I don't know if you want to mention, I signed some folks who were not at the full council meeting to some action steps in the implementation plan. We will be asking you to review that and let us know by December 12th if you are comfortable with what you have been voluntold to be a leader on. Christy may be at child pickup from school right now. I don't see her.
Yeah, I'm here. I just also want to add, when I send out that link again this week, in addition to taking a look at what you've been assigned to, you will also want you to look at the actions that we have identified as a priority for 2026. If there's things in there that you're like, oh, that's really important, but we're not going to start until 2028, like this is the time to note those things and let us know. We're going to start reaching out to our agency members and leads to start setting up some meetings for probably early January, just to kind of start getting ideas and thoughts about what implementation structures will look like for moving those actions forward. So coming to some sort of agreement on the things that we're going to start in 2026 would be really helpful.
And to that end, and the point that Adam Rodakowski made a moment ago, we did get signatures from all 4 of the directors of our partner agencies. So Dr. Williams for the Department of Education, Liesl Went for the Department of Human Services, Dr. Hathi for the Oregon Health Authority, and Director Tassine for the Oregon Youth Authority, that they've actually read this draft strategic plan and said, yeah, we buy in. We're committed to leading in support of this strategic plan. And so we've got their signatures on paper. There's a lot more than just putting your signature on a piece of paper, but it's a good start. And so we're hoping to continue as we work through those planning meetings that Christy mentioned. True buy-in from our agency partners. They're where the vast majority of the work is going to get done. So we're really hopeful that this will be effective. Joylene sent out a very important email to you all this afternoon about the system of care strategic pause that is taking place starting right after our December 16th meeting and going for the first few months of 2026 while we kind of get our ducks in a row around what is the new structure that the council needs in order to actually do the work of the strategic plan. And some implications for people who use stipends or who receive stipends for this work. Joylene, I'm not sure if there's more you want to add there.
Yeah, if you are a person with lived experience already getting stipends for your work with the SOCAC, those are going to pretty significantly slow down. So if you're holding on to stipends that you just need to get submitted, I really encourage you to get that done this week, so that starting next week, when our stipend processing slows down, we can already make sure we have yours in and submitted. More information in that email I sent you all, so please do read every word. Thank you.
And if you have questions, respond to Joylene's email. You can copy any of the rest of the SOCAC staff on there as well. We want to make sure people feel confident and competent moving forward with the information that they have. We had a new ethics law come into place starting on January 1st of 2026. House Bill 2930 is in effect, so that will be kicking off the new year. The definition for conflict of interest in now will include your family as well as yourself. So typically or historically, if you've gotten your ethics training or if you remember our public meetings law training, if you're going to vote on something that you stand to benefit directly financially from, you have to name that you have a conflict of interest publicly. You will now need to name that conflict of interest if you or someone in your household, including a roommate, not just a family member, could stand to benefit for financially. So I'm going to put the link to more information about that policy change into the chat, and that will go out in the meeting notes as well. So if you want to learn more about this, the Oregon Government Ethics Commission has a bulletin that they sent out with information about this new conflict of interest policy. Any questions about that? Not in effect now, but will be in effect at our next full council meeting. Not our next one, sorry, the one after that. Emily Cooper.
I have a question. We have a short legislative session coming up with the strategic pause, including with the legislative committee being paused. Are we not planning on making any recommendations or doing anything legislatively this year or next year?
So we discussed this. I can't remember which of our many meetings we had this conversation. But no, we are not planning on doing much with regard to legislation in the 2026 short session. We did discuss if there are 5 or more System of Care Advisory Council members who wish to form sort of an ad hoc budget recommendations committee around the recommended cuts that agencies have not recommended, the cuts lists that agencies have provided to the legislature for consideration, that we would be willing to, if folks wanted to speak up about those cuts, call together sort of an ad hoc committee on that. But no, we've not, will not be having a legislative committee during a short session in 2026.
The reason I ask is I think Medicaid cuts and the impact, including on a lot of the programs we've talked about today, could be really, really impactful. So I'm glad there'll be an ad hoc budget legislative group. If I can be useful, please feel free to assign me to that. But I think we have a really important voice in those conversations. So I just want to make sure there's that opportunity to have that conversation.
Thanks, Emily. And if you, we'll follow up with more information for everybody about how to participate in that committee. But if you have specific Medicaid budget cuts that you want to name as of particular concern, feel free to put that in an email to me, and that can be your sort of, I volunteer to be a part of this ad hoc committee.
That sounds good. Thanks.
Thanks. And the last thing, our next meeting, as we've discussed multiple times throughout today's meeting, is December 16th from 3 to 5. We will hear the feedback updates on the fiscal report that we discussed. We will look at any changes that have been made in terms of your feedback on the strategic plan. We will vote on whether or not to approve both of those for submission. And then we will take some time to celebrate the folks who are leaving the council, the good work that we've spent this year doing, and one another as truly committed, wonderful human beings who are trying to build a better system. In that vein, we have a little survey that I think only 2 people, myself being one of them, has completed at this point about like, what did you get out of being a member of the SOCAC this year? What is a holiday tradition that you want to share with other folks as like a little way of humanizing yourself with others? So the link for that is here. And again, we can send it out to you. It will be coming out to you in this week's digest, which goes to voting members of the council. But if you want our little celebration time to be humanized by your specific humanity, please use this survey to help us do that. And I think that is it. Staff, did I miss anything on our long, long list of announcements for today?
May I make one more?
Absolutely.
It is not on the list. Sorry to our folks who need a visual companion, but tomorrow from 3 to 5, we have our Family Advisory Committee meeting. This one is a little bit different. We're having Director Tassine from the Oregon Youth Authority come and have an open, more casual type question and answer with our family members. So if you are a family member specifically with a juvenile legal system experience, or you work with those family members or have other folks that you know want to be in the room for that conversation, please just send me a message. I'll make sure that you can get the Zoom link and have it be accessible to you. And if Annette or Alicia had anything to add to that, I'll just make some space. That's all I got.
I don't. Thank you for mentioning that.
Nothing on
Thank
my
you for
end. Thank you.
organizing it. Appreciate it.
All right. Then I think we are done. Co-chairs, is there anything else on your end?
Nope. We got through it all. Thank you, everyone.
See
See you
y'all.
on the 16th.
Bye.